edition of May, Minnesota. I'm really looking forward, not that I don't every day, but today's show especially because, well, I can kind of relate. Dr. Erik Stroemer is with us. He's from the Orthopedic and Fracture Clinic here in Faribault, and we really appreciate his stopping by our studios today. So thanks, Dr. Stroemer, for coming by.
Oh, thanks for having me.
Appreciate it very much. We're going to talk about arthritis today. That's, I was going to say near and dear to my heart, but it's not dear to my heart by any stretch, but it is near to my heart.
Yeah.
That make any sense?
Sure, yeah.
Let's get a little of your background.
So I grew up here in Minnesota. I was raised in St. Paul. Went to college at University of St. Thomas where I played hockey. And I went out of state for med school, came home to do my orthopedic training for 5 years at the University of Minnesota. And then you start looking for jobs, and Dr. Laney, who started our group 30-some years ago here in Faribault, was retiring, and the group was looking for someone new, and some of the head guys there at the University of Minnesota said that Dr. Shepley, Dr. Willie, and Dr. Munch were probably some of the best residents they'd ever had. So I thought, well, heck, this seems like a great gig, and here I am 10 years later.
Still here.
Still here.
And loving it.
Yeah, love it.
It's got to be great to know that you're helping people.
Yeah, that's the one thing that even attracts most of us to orthopedics is in medicine there's a lot of treatments and whatnot, but it's pretty satisfying to be able to fix someone and actually have them return to a fairly normal life like it didn't even happen. So that's been pretty rewarding.
You're a younger guy, right?
Yeah, well, 41.
Well, younger than me. So you probably don't remember the $6 Million Man, the television show. It was in the 1970s.
I think I remember watching it if I got to stay home from school sick. I think I remember watching it on the TV when I was a little kid.
Yeah, and he had the...
He was bionic, right?
Yep.
Yeah. Well, that's kind of what we're helping people with new joints these days. That's definitely a bigger and bigger part of keeping everybody moving.
I went to Italy last April, and someone had just finished having their knee replaced. They were still, knee deep, in rehab, and they went on our trip. And there's a lot of walking on these, European trips, and on cobblestone.
Sure.
So it wasn't much fun for her, I don't think.
Yeah, I don't know. That story sounds familiar. I wonder if she was one of mine. But yeah, it takes a couple months to get over a new knee. We'll talk about that maybe a little later. But it takes a huge commitment to rehab your knee after a new knee. That's something we like to stress.
We're mainly here to talk about arthritis today,
Sure.
Which I have mainly in my hands, although it is starting to, I can feel it in my hips and my knees and my shoulders.
Mm-hmm. Yeah, arthritis technically means the inflammation of a joint. That mainly is occurring when the cartilage cushion in that joint is wearing out. That happens from osteoarthritis, which is the wear and tear arthritis, the most common thing we all get. There's also other arthritises like rheumatoid arthritis, arthritis associated with psoriasis. There's a lot of other diseases as well that can cause arthritis. Nonetheless, there's a lot of joints in your body, and every one of them can get worn out from various factors. So that's why I have a job, because everyone's living longer, everyone's wearing out but wants to stay active.
Yeah, there's no cure for arthritis.
Correct. As of right now, there is no cure for arthritis. There's not been a proven way to grow your cartilage back in a substantial way. There is some new things where they can grow back. Say you're missing a quarter-sized piece of cartilage in your knee, we can kind of figure out a way to get that to grow back or graft it. But if the whole knee is shot, right now there's no cure. It's kind of like if you have a really perfect street but have a pothole in it, we can fix the pothole. If you have a really crummy street and the whole thing's bumpy, there's no way to fill all the potholes. You pretty much need a new street.
Yeah, we're going to visit more with Dr. Stroemer, talk specifically about arthritis. By the way, you can text me any questions you might have too. I might not think of. My my text number is 507-838-5233. 507-838-5233 if you'd like to have us ask Dr. Stroemer a question concerning arthritis on AM Minnesota.
Are pretty much my specialties as well.
Now, is this just because it's available now, or are we actually wearing our joints out more nowadays? It seems a lot of my friends are getting
Sure.
hips and knees
Sure.
and all that sort of thing.
Well, I think it's a new phenomenon that people are living longer, wanting to stay active longer. I was mentioning off the air, my grandparents, I don't think, strayed far from the pool after they were 65 years old. So people now want to be more active, do more. They want more out of their bodies. So we're here to try to help them along the way.
Yeah. Let's touch on arthritis. First of all, what is arthritis?
So arthritis means that a joint is wearing out, it is inflamed. Primarily that means the cartilage cushion in each joint is now wearing away. Every joint that you can look at yourself and move, there's cartilage on each side of that bone that creates a cushion that's more slippery than ice on ice. And as that cushion erodes, things become roughened, things become inflamed, things become stiff. Your body makes more joint fluid to try to lube itself. So that's why most of the time when people have a joint that's wearing out, it'll become painful, stiff, and swollen.
Do we know why it hits some people and not others?
Good question. We don't have an exact way to figure that out. I think now with mapping people's genes, we may be able to figure out earlier who might get it. But arthritis is from three main things. Genetics, it definitely runs in families. Wear and tear and injuries, so if you stand on concrete floors your whole life, you may wear out things quicker. And weight. The heavier you are, the quicker your joints will wear out. Just like if you put little car tires on a heavy pickup truck, those tires are going to wear quicker. So those are the three main things that cause it. And obviously we can't change our genetics. Our careers we've chosen already, so we can't change the past. So the one thing we can help counsel people on is trying to get some weight off. That will definitely help you stay out of our office.
That's the number one thing
Well, I think because we can't change, we can't modify the other things, we definitely that's part of the initial treatments of arthritis, especially in your back, hips, knees, ankles, is trying to get some weight off. Every pound you carry of weight is 4 pounds through your knees, so 4 pounds of pressure. So even a modest weight loss can really help your joints feel better, allow you to do more things, and stay out of the doctor's office.
Yeah, think about these big offensive, defensive, professional football players, and
Yeah.
the kind of pressure they put on their knees.
Yeah, I mean, I don't know the statistics, but I would imagine it's a majority of retired NFL players have to get new knees. I mean, I don't know the statistics off the top of my head, but I would suspect it's quite high.
Yeah. Is that the number one thing you do in your practice?
I think it's still replacing the hips and the knees. That is definitely the first thing. Shoulders tend to wear out less because we don't walk on our arms. And then a lot of people come in where they tear something or break something from just a routine activity that they like to do. Could be doing something, playing golf, could have been skiing, could have been just slipped off the curb. So fixing people's worn out joints and fixing the arms and legs that have been injured are pretty much our main things we do.
Yeah, you guys have come a long way. I know that because when I was a kid in high school, I had knee problems. I was a catcher, but I had knee problems. I went to Mayo Clinic I don't know how many times and saw so many physicians, and they bring in multiple people. I was like the education class.
Okay.
This young guy, 16, 17 years old, he's got the knees of an 80-year-old. What's going on here? So I can tell you've come a long way since those days, because they were wondering. Anyway, we've got a text question here. This person knows something about this because they ask, what is the difference with cortisone injections and rooster comb injections?
Oh, that's a great question. That was right at the top of my notes here. So one of the initial treatments for arthritis is injections. We also recommend you try, even before injections, try and just take some occasional Tylenol or occasional Advil. Even physical therapy can help arthritis prior to even needing injections. The stronger the joint is around the arthritis, the less it'll hurt. So back to the injections. Those are the only two FDA-approved injections for arthritis. There's a couple other things we can talk about later, but cortisone is an anti-inflammatory. So if you rolled around in poison ivy, you'd get cortisone cream because it's an anti-inflammatory. If you had an allergic reaction, they'd give you an IV form of cortisone. So cortisone is a strong anti-inflammatory that we can inject into a joint that sticks around in there for 3 to 4 months to help with pain. Again, it's not curing it, but it's a treatment. The rooster comb shots technically are called viscosupplementation. That's a big word. Even I don't like saying it, so yeah, I still even say the rooster comb shots to some people. That is a physical lubricant. So when you inject it into the knee, it's somewhat like an oil change. Your knee is wearing out, and we are now installing thicker, more viscous fluid to help smooth off the rough cartilage. Then hopefully the knee will calm down, work better, and feel better. Should be pointing out the rooster comb shots, again, are only FDA approved to put in the knee. They're not FDA approved to put in a worn out hip, a worn out shoulder, a worn out ankle. So insurance will only pay for it to put in your knee. Now, on a side note, I mean, if people remember, Brett Favre had a bad ankle when he was playing for the Vikings, and he was getting the rooster comb shots shot in his ankle. Obviously, they can do things off-label if they're going to pay, a lot out of pocket. But so the difference is, one is a very strong anti-inflammatory, which is cortisone. The other, it's a physical lubricant to try to help cushion and alleviate the rough spots of the knee.
Why is it called rooster comb?
It was initially invented from the fluid in a rooster's comb.
That's what my speculation was.
Yeah, it is now not. None of the brands actually contain rooster's protein. You will not be waking up at sunrise crowing or laying eggs or anything. They're synthetically made, and so, but it's just one of these things that took on a life of its own that people kind of refer to that. Now we're kind of say arthritis gel, or we say viscosupplementation, and but yeah, I have patients that get years and years out of their worn out knees before they need anything more, just because of these shots.
Yep. Well, you hear all the time about pitchers, major leagues, getting cortisone shots.
Yeah, I mean that for the young baseball pitcher, most likely it's inflammation of one of the muscles or tendons around the shoulder, and it does do wonders to help with inflammation.
And there's no side effects?
Well, there's a couple. So when you inject cortisone into a joint, we're not injecting into your bloodstream. So a majority of it just stays right in the joint. It's not going into your other organs. You can, if you get multiple cortisone shots in one area, it can change the pigmentation of the skin at the injection site. Most people don't even really notice that. Side effects, if you have them repeatedly in a healthy joint, it can actually soften and ligaments and tendons around that joint. So that's why we usually reserve cortisone for joints that have incurable problem. It's not a good thing to shoot cortisone into a 20-year-old's knee just so he can play softball. That's not a good idea. We use it when people have an incurable problem, where it's one of the treatments we have left.
This has been around a while, though.
Cortisone has been around, yeah, longer than I've been alive.
Yeah.
So it's very safe. Occasionally someone has a reaction to cortisone, but just as though some people may have a reaction to Tylenol. So it's been around a long time.
My dad had it, as we chatted before going on the air. He played tennis into his 70s. He did sit-ups every night into his 80s.
Wow.
Because he took the doctor's advice to heart. The doctors told him exercise is really good for your arthritis.
Correct, and that's something that we shouldn't lose sight of. There's a lot of things you can do to help your arthritis without having to have me help you. Moderate exercise does help your joints. It appears when you move your joints, you're naturally producing fluid in these joints, creates an anti-inflammatory effect. It releases some endorphins, which is really a pain med for your joints. and you may cut some calories and lose a little weight too. So low impact, moderate exercise is extremely helpful for an arthritic joint, which seems counterintuitive because your knee hurts and you don't want to exercise, but figuring out a way to do it in a low impact, moderate way will help you in the long run.
Yeah, I was just going to say, I already talked about the fact that I had knee problems as a kid. My knees got stronger when I started riding bike a lot.
Yeah, that bike is an excellent choice because it's less impact than even walking.
Right.
So people have access to an exercise bike at home or a health club or anything in a pool, but still walking, even outside or on a treadmill, is excellent.
Sounds good. We have some new methods these days?
Well, I was just going to mention, so injections, the two injections, the cortisone and the rooster comb shots, if you will, we do every day. We have ultrasound machine in the office to help us watch the needle go into the right spot. Okay. Ultrasound doesn't create radiation either, so everybody likes that because it's not like X-rays and things like that. So we have one of those in our office, and some of the people in our office are extremely skilled at just using this machine to put the medicine right where it's supposed to be. There's a couple new injections that you'll read about, but you won't really hear about a lot, that are on the forefront of arthritis treatment. One is re-injecting platelets back into you, called platelet-rich plasma. That's where we take a little blood from you, spin it in a centrifuge, get the good cells, and we inject that back in. That's been having promise in things like Achilles tendonitis, tennis elbow, things like that, and some in arthritis. There's also a way to do the same thing with stem cells, where we take your bone marrow out of a bone, spin it down, get the good cells. Both of these are considered investigational. They are not approved by the FDA yet, so insurance won't cover them. So we have the capability to do this, however, it costs a lot of money out of pocket. And even myself, who I feel gets paid well, I don't know if I can't look someone in the eye and say, for $1,000 this is going to cure arthritis, because it's not proven.
Right.
There's some, I think in my lifetime these new ways are going to be just like the cortisone shot, but has to go through the hoops of the FDA to get everybody on board.
Yeah. Including the insurance companies, which is probably the number one thing you guys have to deal with too.
Yeah, and I think we want to do what's right for the patient. If one of these shows extreme promise, I'm sure we'd be doing it every day, and we'd figure out a way to get the cost down. But what we like to do is have kind of a patient-centered decision-making process where we ask the patient, what's your goals here? What do you want to be able to do? Do you want to just be able to walk around the mall comfortably, or do you want to ski down, Mount McKinley? So we kind of talk about what their goals are and what are the things that we think could do it. So that's, as far as injections, those are the only other new things on the forefront. And again, they're not FDA approved. We can do them, but it's not covered by insurance. We have to pay out of pocket, which is a little unfortunate.
They're over-the-counter medications that can help you with your arthritis.
Sure. So the two main ones over the counter, Tylenol, which is acetaminophen. That can be helpful with for joint pain. You have to be careful with that. That does affect your liver. So if you have any liver problems, or if you drink a lot of alcohol, it can affect your liver. So you need to stay away from that. Conversely, ibuprofen, which is Advil or Motrin, also can help with joint pain. That can affect your kidneys and your blood pressure, as well as your stomach lining. So again, these medicines that are over the counter still have side effects that you need to talk to your physician about and see if it's worth the risk benefit.
Yeah, because you don't want to take them every day, kind of thing.
Correct. We used to think you could take Advil every day and it wouldn't be a problem. Turns out that's completely untrue. And there's a lot of people that end up in the hospital with a bleeding ulcer or a kidney problem or a blood pressure problem from taking it too much. Lastly, there's over-the-counter supplements called glucosamine, chondroitin. Those are two big confusing words, but it's essentially a cartilage medication that some people feel really helps their joints feel better. It's not a medication, it's a supplement. So it's not regulated by the government. So there is some more reputable companies that make this, some not so reputable. So I think if you look on one of those bottles and it says it's been vetted by the Arthritis Foundation, things like that, I think you're safe in knowing what's in the medicine or what's in the supplement. But I see a lot of people now on these glucosamine chondroitin supplements that feel that their joints feel less stiff, less swollen, and hey, if you can take a little medicine and not have to get a shot, that's worth it.
Can they do surgeries taking cartilage from some other joint in your body and replacing cartilage in other parts of the body?
You could do that. I would say we do it more specifically in the knee. We can borrow some plugs of cartilage from a part of the knee that doesn't need it as much and plug it into the part that's worn out. You're kind of robbing Peter to pay Paul. Is that the
Sure.
saying?
Yeah.
So we don't usually like to injure another joint just to help one joint. So usually we don't borrow cartilage from another joint to go in the injured joint. There is now such a thing as cadaver cartilage transplants, where you can someone who donated their joints after they pass away, you can...
Something I haven't even thought of, that you
Right.
can donate your joint.
Yeah, you can donate your bones and cartilage, and that can be used in our surgeries to help your cartilage.
That'd probably be better than...
Yeah, I mean, it's pluses and minuses. Obviously, using your own cartilage, it's your own cartilage that's still alive and just came out of you, whereas it's from a cadaver. It's been gone through a whole cleansing process, and it gets radiated to kill things, so there's no infection risk. So there's pluses and minuses that we argue at our orthopedic conferences all the time.
Yeah. Sounds interesting, though. But
Yeah, there's some very interesting things coming down the road that I think is every 10 years we're going to see a shift in the treatment for this stuff.
And Dr. Erik Stroemer is with us. If you have a question, by all means you can text it to me. That other question was awesome. My phone number is 507-838-5233, 507-838-5233 if you'd like to text a question to the good doctor. Anything else you wanted to cover today before I boogie out of here?
Well, I was thinking about talking about joint replacements, which is one of the main things we do. One of the new things we do is called the anterior hip replacement. It's kind of a game changer. Not many people do it, and Dr. Munch and myself did a lot of extra training, and it's been hugely transformative in our care for hip arthritis. You use a smaller incision through the front of the hip, so you don't have to cut any muscles. The traditional way, through the posterior, the back of the hip, you have to detach some muscles to get in there. So this is a newer way that is less painful, less invasive. People have been leaving the hospital earlier. People have been getting out of therapy quicker. They've been getting off canes and walkers quicker. And it's just been really a game changer for me in giving people new hips. I would say similarly, knee and shoulder replacements have gone through some modifications, that it's a much better experience than, say, 10 years ago even. Where we're doing it through smaller incisions. The anesthesia doctors have come up with new ways to keep your joint numb while you're recovering. The actual metal and plastic parts are more anatomic, trying to make for a more natural feeling joint.
Somebody did just remind me that when you go to fairs or other events, you'll see sometimes a tent where they have these bracelets that they sell that are supposedly supposed to help with your arthritis.
Oh, the copper,
Yeah,
those copper bracelets. The science behind that is not entirely proven. But again, I have not read anything harmful with that. So some people really feel that there's some anti-inflammatory properties in the copper and the magnets and things like that. And I don't discount that at all. I think I I tell people to try anything that, you know, they want, as long as it doesn't appear to be dangerous. And both those things don't appear to have any side effects on the negative side. So it's one of these things where it could work, it may not, but on the downside, I don't think it's going to do anything harmful to you.
Yeah.
So
I
think it's worth a try.
Fooey, but there you go. I think
Well,
I might give it a try.
Yeah, I mean, again, I think trying things that aren't going to harm you in the long term, I think is is reasonable.
So how do people get in touch with your office if they're
That's
interested?
a great question. So the easiest way is via the phone. Our number is 507-334-1601. We have a website too. If you just type in Orthopedic and Fracture Clinic, we'll you can find all the information there as well. I did want to say one thing. I went in the office this morning before this to do some paperwork, and I was looking around at all the people I work with, and how great a place it is. Of the 9 people that are in our office every day, they've been in our office a total of 161 years.
Wow.
So we have 161 years of nursing tech managers that have stuck around. Our three physical therapists have been around, have a total of 50 years experience, and the doctors have a total of 80 years experience. So I ended up, we have 300 years of just straight orthopedic experience in our little office here in Faribault, and it's a great place to work. People really care, real personal service, and it's just been a joy to work there. So that's